David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and County Executive Crowley, I'll hand things over to you to get us started.
Well, awesome. Thank you so much, Catherine, and good afternoon to everyone who is joining us. So first, today I want to start off by sharing some updates about a new COVID-19 vaccine incentive program Milwaukee County launched that allows employees to receive about $25 bonus payment for each colleague that they successfully encourage to get vaccinated. And these are our Vax champions. And this program will run through December 31st. And employees who receive their first shot after September 2nd can identify as a Vax champion as part of their Milwaukee County vaccination mandate verification process. And so we want to encourage other Milwaukee County employers to consider implementing a similar type of incentive program, particularly within their workplace, to encourage more people to really get vaccinated. But I also want to share a few updates about our Milwaukee County vaccine mandate for our employees. And so as of October 1st, all county employees who are not members of a public safety unions were required to submit documentation verifying their fully vaccinated status or a completed medical, religion, or creed exemption in an accommodation request form. And over the past few weeks, we've worked closely with department leaders to really review employee vaccine data and really evaluate any barriers staff may have as they try to submit proof of vaccination. And this is a time-intensive process that we're still working through, but I'm happy to report that the vaccination numbers continue to climb for Milwaukee County in the right direction. And so to date, 3,112 staff members, or about 78% of our staff members, have submitted either proof of vaccination or an exemption request. And this is an increase from the 72% that we reported on a few weeks ago. But to give you a further breakdown of the data, just over 2,600, or about 26% of employees submitted their proof of vaccine. About 195, or 5%, of our employees still have their vaccination verifications pending. 202, or 5%, of employees received approved exemptions, and 95, or 2%, of our employees have exemption pending, their exemptions pending. And so the current administrative order, it defines a completed vaccination as an individual who has completed either 2-dose series of the Pfizer or the Moderna vaccine or the single dose of the Johnson & Johnson vaccine. And so this does not include any booster vaccinations at this time. And so we're going to continue to be transparent, reporting all the data that we have available to us and provide updates as we are hopeful that we continue to see the vaccination numbers rise, particularly among Milwaukee County employees. Again, I want to say thank you for joining us. And with that, I'll hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 164 new cases per day and about 1 death per day. Overall, we are seeing very encouraging trends. Our cases have been consistently trending downward, as is our percent positive, now at 6.4%. Our COVID hospitalizations continue to decline, and finally, we're seeing a decline in daily deaths from COVID. Now, at the moment, all of our trends are certainly going in the right direction, but we also know that this is not the last we will see of COVID. More surges will come, more variants will rise, and the best way to protect yourself and your community is through vaccination. On the vaccine front, booster doses are now approved or authorized for all 3 COVID vaccines, allowing millions of Americans to enhance their protection against the virus. Now, who is eligible and which booster should you get? The answer depends on your initial vaccine. For those who received Pfizer or Moderna, if you're 6 months out from your second dose and are either 65 years and older, or if you're 18 and older with a high-risk occupation, living situation, or medical condition, you can get your booster. And for anyone who received Johnson & Johnson 2 months or more ago and are 18 years and older, you can get your booster, regardless of risk factors for Johnson & Johnson. Now, the next question is, which vaccine should you get now that mixing or matching of boosters is permitted? For those who initially got Pfizer or Moderna, it doesn't seem to make much difference which of those 2 vaccines you get as your booster. However, if you initially received the Johnson & Johnson vaccine, there is evidence suggesting the Moderna or Pfizer booster may provide a stronger immune response for you. Now, either way, the most important thing is to get boosted and maintain that strong protection from COVID. In other COVID news, as we speak today, the FDA is reviewing the Pfizer vaccine for 5 to 11-year-olds. Many parents, myself included, eagerly anticipate authorization and will be first in line to get our children and our community protected. So why do I trust the vaccine and why do I want to get my child vaccinated? Well, Pfizer recently released more data to the FDA on their study. They enrolled several thousand children in this age group, and they found that the vaccine prevented 91% of infections. And as for side effects, it was very similar to adults. Some sore arms, some body aches, some headaches, occasionally a low-grade fever, but no serious side effects were found. The bottom line is that this vaccine seems to be safe and effective in children, much as it has been in adolescents and adults. These vaccines at this point have been given to billions with a B, worldwide, and are some of the most studied drugs in history. There's nothing experimental anymore about the vaccines. So parents should feel very confident getting this vaccine for their child. I know that I will. Next, Halloween is fast approaching, leaving many parents wondering how safe it is for their kids to participate. The good news is that trick-or-treating is a fun and safe activity for your kids. We've learned a lot about COVID since last Halloween, and we now know that spread of disease in the sort of outdoor environment where trick-or-treating takes place is highly unlikely. So let your kids go trick-or-treating. Now, as always, take normal precautions that we should every year, especially if trick-or-treating at night. Wear reflective clothing, bring a light, take care crossing the streets. While trick-or-treating is safe from a COVID perspective, you still want to be careful with indoor activities that surround trick-or-treating. This is where COVID is more likely to spread, so avoid those indoor gatherings. And if you do end up going, wear a mask and keep your distance. So, take-home points. Boosters, take a look at the different requirements. If you got Johnson & Johnson for your first dose, consider Moderna or Pfizer for your second. Kids' vaccines, they're coming soon. They seem to be very effective. They have a great safety profile. Keep your kids safe by getting them vaccinated. And finally, Halloween. Let your kids trick-or-treat. Be safe, but avoid indoor gatherings and have fun. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. We'll start this week with our updated gating metrics. Our disease burden has declined over the past 4 weeks since peaking the week of September 23rd. Today, the burden in the city of Milwaukee is 148.8 positive cases per 100,000 people, which moves us back down into the high transmission category for the first time since the beginning of August. The 7 to 8% test positivity has also decreased to 5.8% and moved into the moderate transmission category. We're encouraged by this decline, but we need to stay diligent, especially as we move indoors with the colder weather. Mask up when you're with anyone outside of your household. Avoid large gatherings, especially indoors. Maintain physical distance when possible, and wash your hands thoroughly and often. In addition to protecting you from COVID, these measures will also help keep you healthy and safe as we head into flu season. However, the best way to protect yourself from both COVID and the flu is to get vaccinated. Both flu shots and COVID vaccines are available for free at all Milwaukee Health Department sites. Currently, 58.2% of Milwaukee adults are fully vaccinated from COVID-19, and 63.2% have received at least their first dose. The new Menominee Valley drive-thru site, located at 2401 West St. Paul Avenue, is open Monday, Wednesday, and Friday from 12 to 6 p.m. and Tuesdays and Thursdays from 9 to 3 p.m. This is a quick and easy option to get a COVID test, COVID vaccine, or flu shot without leaving your car. In fact, Mayor Barrett received his flu shot at the Menominee Valley site last Friday. In addition to the Menominee Valley site, Northwest Health Center and Southside Health Center's daily hours, the mobile vaccination team continues to bring vaccines into the community. This week, we're working closely with the Seton Catholic schools to vaccinate students, staff, families, and community members. Today, we're at the Northwest Catholic School from 3 until 5 p.m. Tomorrow, we will be at UW-Milwaukee's Student Union from 10 a.m. to 3 p.m., Ascension All States Family Health Center from 1 to 4 p.m., COA Golden Center from 3 to 5 p.m., and St. Thomas Aquinas Academy from 3 to 5 p.m. Thursday, we'll be at St. Charles Borromeo School from 3 to 5 p.m. and MATC's Walker Square from 3 to 6 p.m. Friday, we'll have vaccines available at Prince of Peace School from 3 to 5, St. Catherine's School from 3 to 5, and the Next Door Foundation from 3:30 to 4:30. The full updated list of mobile vaccine clinics can be found at any time at milwaukee.gov/COVIDvax. The $25 gift card incentive for second doses of vaccine that was announced last week continues at the Northwest Health Center, Southside Health Center, and Menominee Valley drive-through site. Any City of Milwaukee residents who receive their second dose of the vaccine at any of these locations will receive a $25 US Bank gift card on site. It's crucial to complete your vaccination series to have a full immune response. And we hope this incentive encourages individuals who have not gotten their second dose to do so as soon as possible. Gift cards will be available while supplies last. Finally, this Friday is the final day for the City of Milwaukee employees to submit their proof of COVID-19 vaccination or obtain an approved exemption to comply with the vaccine mandate. We don't have complete data at this time for the vaccination rate among city employees, but we'll have more to share after Friday. Thank you.
Thank you, Commissioner Johnson. Our first question comes from Drake Bentley with Milwaukee Journal Sentinel. Perhaps Dr. Weston, you can jump in here. He's wondering, when can we expect to see data on booster shots?
I assume we're referring to local data as far as how many folks have received booster shots. So that's something we're working with the state to better understand how they're collecting that data and how we can represent it and share it.
Excellent, thank you. I will just give it a few more minutes to see if there are any further questions. Otherwise, that would conclude our briefing. So just one more minute here. All right, a few questions coming through. Derica Williams with FOX6 is wondering, what are the plans for the rollout when the vaccine for kids is approved?
So I can take this one to start. We are working with MPS and other school districts to coordinate vaccine clinics for children that are pediatric friendly. We are also planning to have child vaccine incentives, and we will be likely announcing them next week. But we are making plans and working with our healthcare systems to have a better understanding of where people can access vaccine for children.
And that's similar for the other health departments, similar for pharmacies, similar for health systems. They're looking into what their capacity will be as far as the timeline. And I see that's a part of this question and a question coming up. So it's being discussed today. I think by the end of the day, we'll have an answer. I think it'll be in the affirmative to recommend authorization for 5 to 11-year-olds for Pfizer. That would mean that the formal FDA authorization would probably come in the next day or two. And then the CDC's advisory committee is expected to meet next week, November 2nd and 3rd. And presuming that they also agree to put this into the guidelines, I think the CDC would formally recommend it probably as soon as the evening of the 3rd, I think more likely November 4th. So we could be seeing shots in arms, depending on supply chain, depending on the DHS recommendations, and depending on vaccinators, potentially as soon as the end of next week.
And then just one more part of that question is, how many can be ordered? How many shots can be ordered?
So I can answer that. We, all vaccinators in the state of Wisconsin were able to submit requests for the supply that they want to keep on hand. And we haven't yet gotten an answer about the final numbers, but I do know that our health care systems in southeastern Wisconsin and Milwaukee, and many of our health departments have requested vaccines. So I'm hopeful that there will be ample supply by the end of next week.
Excellent. Melissa Zygowick with CBS 58 is just wondering, do you expect schools to require the vaccines once approved?
I don't think schools will require the vaccines initially as soon as they're authorized. I think it's likely that with time, schools will require the vaccines. I think it's likely that with time, this will become similar to many of the vaccines that our kids get in school, just part of the routine vaccination schedule.
All right, I believe we've answered a few of these, but just a follow-up question from TMJ4. What are your thoughts on mass vaccination clinics when that time comes for children?
I can take this one too. So Again, we anticipate potentially by the end of next week that we'll have vaccine for children. We have talked significantly within the city of Milwaukee and with the county around what's the best pediatric setting for children for vaccinating children, and knowing that it's a little bit more complex, meaning that children cry. And so mass vaccination sites are not an ideal setting for children. Partly, and this, you saw this too in Biden's plan when it was announced, I believe last week, that really looking at primary care providers as a resource, but then also trying, again, like we said with the Milwaukee Health Department, we're looking at working with MPS schools and other schools in elementary school settings where kids are comfortable and potentially where we can separate them into a classroom where they feel safe, and a much more individualized experience. So no, unlikely that we will have a mass vaccine clinic, primarily because we just don't think it's an appropriate setting for pediatrics.
Thank you, Commissioner. Our next, and what I believe is the final question at this time, is from Kent Wainscott with WISN 12. He's wondering, do you have any local info or data on the numbers of breakthrough positive cases among fully vaccinated people?
So there is DHS data that's been released for Wisconsin, and that data largely mirrors what we've seen from studies across the country, what we've seen from other health departments and cities and states across the country. The vaccine is extremely effective in preventing COVID illness, in preventing symptoms from COVID, preventing hospitalization, as well as death from COVID.
Thank you, Dr. Weston. All right. I believe those are all the questions in our chat for today. Thank you, media, for joining us. Thank you, guests. We appreciate your time, and we'll see you next week.
Thanks, everyone.
Thank you.